Hey everyone, I'm Dr. Jeremy Sutton, physical therapist with Healthy SBC here in North Louisiana. And today we're going to be talking about plantar fasciitis, and I'm going to show you two taping techniques. One called Navicular Sling that we're going to do on this foot with the blue kinesio tape, and one called low dye taping that we're going to do with just the regular white athletic tape. Okay, super easy to find. So what is plantar fasciitis? So the plantar fascia connects from the heel of your foot up to your toes, and it's a thick band of tissue that runs up and down the bottom of your foot. Think of it like the liner on the phone book. If you remember what a phone book is, it's really thick. The backing on any kind of textbook that's really thick. And so it's hard to make any change on this. So when it hurts, it gives you a lot of trouble, and it's difficult to treat. And a lot of people, especially runners, pickleball players, things like that, deal with this issue. There's three kind of gold standards of if it is pickleball, if it is plantar fasciitis or not. And those are: one, that there's point tenderness to the medial part of the heel, or the inner part of your heel, because the plantar fascia attaches right here on the bone on your heel. That's the first thing. Two is if you're sleeping and you get up early in the morning and you walk hunched over for 3 or 4 steps and it hurts until you can kind of stand up straight and walk straight. That's the second thing. And the third one is if you've been sitting for a prolonged period of time, like you've been on a long trip in your car, you've been sitting in your office or whatever, that it hurts either in the heel or the arch on the inside when you get up. So those are kind of the three gold standards of, do I have plantar fasciitis? Because a lot of people say, well, my foot hurts on the top, my calf hurts, whatever. Those really aren't, they could be plantar fasciitis, but those aren't for sure. So these two taping techniques I've used for the last 15 years. They work really well. They don't fix your plantar fasciitis, but they stop the pain a lot of times so you can walk without pain, so you can run sometimes. I have had plantar fasciitis. I've been able to run with this taping technique with both of these. So I usually, if it's somebody's having pain on both feet, I will tape one way like we're gonna do in the video. I'll tape one over here and this one differently. If not, if it's the same foot, then I'll tape it one way. And if that helps, great, we'll leave it that way. If it doesn't help, we'll try the other way. Sometimes one or the other feels better. The first one is the Navicular Sling that we're gonna use, and we're gonna use this blue kinesio tape. So kinesio tape, this box right here came from Academy. It's called KT tape. I like the cotton blend. It's a little easier on your skin. You can get this, I think this was like $12. I also have this Body Sport brand that I bought probably 6 years ago, but it's blue. I like the color. It's cotton as well. Doesn't matter what kind you get. I really like the cotton, but if you don't get the pre-cut strips, so this wasn't pre-cut, I cut these before the video, make sure you round the edges with your scissors, because if not, they'll roll up a lot easier, a lot quicker, and they won't stay on as long, okay? So for the Navicular Sling, the navicular is this bone right in here, so in the medial arch. So a lot of times you have that may be dropping. You may see somebody has what looks like a flat foot, and so we'll tape them like this first. And so basically we start out on the lateral side or on the outside of the foot, and we bring the tape around the foot with no pressure. So we're just easily laying it around the foot, and then we hold it here, and then we pull the pressure up on the medial and then pull it up, okay? So we're gonna do that. Hold your foot back, please. And so we're gonna start here. Some people I like to do it at an angle. It doesn't really matter. I just like the way it looks a little bit better. And so then we're gonna pull it around with no tension whatsoever. So now I'm holding that there. Hold here, and then I'm pulling up and over and taping, okay? And then I always like to do a second piece of tape, and we're gonna overlap that about half. And let me move my arm. So we're gonna overlap that about half. Okay. So again, we're gonna start on the lateral side or the outside, overlapping about half of the other piece. Pull it around. Hold here, pull up and over. Smooth that out. Move your foot around a little bit. Does that hurt at all?
No.
Okay, perfect. So that's good. So that's the first. That's Navicular Sling. One thing I forgot to mention is when you are taping this, always have them pull their foot back so we can keep it flexed like this, so we can put it on there. So we're gonna do the same thing on this foot, except for we're gonna do the low dye taping method, okay? So You can use kinesio tape for this, but kinesio tape gives a little bit more. It has a little bit more flexibility or pull than the athletic tape does. So I like to use the athletic tape for this. You can use the athletic tape for both. I found it doesn't really matter on the Navicular Sling taping. Either one is fine, but I really like the athletic tape for the low dye, okay? So the first thing we're gonna do is kind of make a stirrup for the foot. So hold your foot back. On this one, it does not matter if you start on the inside or the outside for this part. So I start about the base of her toe or her metacarpal head, and then go around her heel, come back over. And I always do 2 of those, just overlap about half on that as well. And that just makes it a little bit stronger to hold on to, okay? And then we're gonna start either at the top or the bottom, it doesn't really matter. And we're going to go from the outside or the lateral to the inside, and we're gonna pull it over, pull each one over. Helps if you're strong enough to tear the tape. Does that feel okay? Mm-hmm. Again, I'm overlapping each piece about halfway on each time, okay? And I'm not pulling hard. I'm going all the way to the heel. I like to leave the heel out. Doesn't really matter. It's just a personal preference, just to give a little space there. And then I do one more stirrup around to lock that tape in. And then I like to go around the top here to lock it in there. So we've got a stirrup here to lock in all the strips that we put on the bottom, and then we have one here to lock it in at the top. And then I make sure that's nice and smooth. All right, move your foot up and down a little bit. Is that okay? Yes. No pain with that? No. Perfect. So that is, pull your foot back over here. That is low dye taping on this side. So low dye, we've taped the whole bottom of the foot except for we've left the heel open. This is a Navicular Sling on this side. Next, what I would do is have her get up and walk around the clinic or the living room or wherever we are. Make sure it's not painful. If it's painful, always take it right back off. Say, hey, we're not gonna walk like that if it hurts. And then if it doesn't hurt, then I say, okay, wear that today. If it starts to hurt you, sharp pain, cause any numbness or tingling, purple, toes turn purple, whatever, take it off. Always tell them take it off if it bothers them. But I would basically just say, hey, get up, walk around. Does it feel good? Yes. If it does, leave it on, at least for the day. And then I would teach her by sending home with this video or instructions on how to teach this. I would video this in the clinic or the home so they could watch it later, the spouse or whoever could help them do it later. And that's it. And that's what I would do. So Navicular Sling taping on this side, low dye taping on that side. Try that out. Let me know if it helps. And if you have any questions, just put them in the comments. I'll be glad to help you out. Thank you.